Good afternoon to one and all present today. 4th February is observed as World Cancer Day, led by the Union for International Cancer Control. So, we, the NSS volunteers, have organized a short event to raise awareness of cancer and to encourage its prevention, detection, and treatment. Cancer is one of the world's leading causes of death, and its burden is growing. In 2021, the world crossed a soaring new threshold. An estimated 20 million people were diagnosed with cancer and 10 million died. These numbers will continue to rise in the decades ahead. But all these cancers can be treated and many can be prevented or cured. For all of these reasons, the theme for this year's World Cancer Day is closing the care gap. So, to elaborate further on this, I invite Nikita, Anisha, and Prabhakar with a short PowerPoint presentation.
Moving forward with the first slide, which talks about World Cancer Day as a leading international awareness day. World Cancer Day, held every 4th February, is the global uniting initiative led by the Union for International Cancer Control in order to create awareness, inspire change, and reduce the global impact of cancer. The aim is to reduce misconceptions surrounding cancer and the prejudices associated with it to help people in getting the right information about cancer. It also offers a chance to make an impact in the betterment of the life of cancer patients and survivors. Created in 2000, World Cancer Day has grown into a positive movement for everyone, everywhere to unite under one voice to face one of our greatest challenges in history. In the next slide, we will discuss the theme for the year 2022. So, this year, 2022, the theme of World Cancer Day is Close the Care Gap, which is all about understanding and recognizing the inequities in cancer care around the globe. The theme revolves around identifying and recognizing global disparities in cancer care that prevents people from certain economic strata full access to essential healthcare services and facilities. Inequity or the unjust and avoidable differences in cancer care cost lives. In slide 3, we will talk about what cancer actually is and get a clear understanding about it. So, cancer is a disease which occurs when changes in a group of normal cells within the body leads to uncontrolled abnormal growth, forming a lump called a tumor. This is true of all cancers except leukemia. If left untreated, tumors can grow and spread into the surrounding normal tissue or to other parts of the body via the bloodstream and lymphatic systems and can affect the digestive, nervous, and circulatory systems or release hormones that may affect body function. In the next slide, we move forward to the types of cancers. So, there are mainly 5 types of cancers classified according to the type of cells they start from. So, the first one mentioned here is carcinoma. Carcinoma is a type of cancer that arises from the epithelial cells and may invade the surrounding tissues and organs to the lymph nodes and other areas of the body. Breast, prostate, lung, and colon cancer are the common forms of cancer in this group. The second one is sarcoma. Sarcoma is a type of malignant tumor of the bone or soft tissue, and the most common forms of sarcoma are leiomyosarcoma, liposarcoma, and osteosarcoma. The third one is lymphoma and myeloma. Lymphoma and myeloma are cancers that begin in the cells of the immune system. Lymphoma is a cancer of the lymphatic system which runs all through the body and can therefore occur anywhere. Myeloma starts in the plasma cells. This cancer can affect the cell's ability to produce antibodies effectively. The next type of cancer is leukemia, which is a cancer of the white blood cells and bone marrow. Lymphocytic leukemia and chronic lymphocytic leukemia are the common subtypes. The other types of cancers are brain and spinal cord cancers, which are also known as nervous system cancers. Some are benign, while others can grow and spread. Now, I would like to request our next speaker, Anisha, to move forward with the presentation.
Causes of cancer. Alcohol. The evidence that all types of alcoholic drinks are a cause of a number of cancers is now stronger than ever before. Alcohol can increase the risk of six types of cancer, including bowel, breast, mouth, larynx, and larynx, esophageal, liver, and stomach. Age. Many types of cancer becomes more prevalent with age. The longer people live, the more exposure there is to carcinogens and the more time there is for genetic changes or mutations to occur within their cells. Cancer causing substances are substances which change how a cell behaves, increasing the chances of developing cancer. Genes are the coded messages inside a cell that tell it how to behave. Mutation or change to the gene, such as damage or loss, can alter how that cell behaves, making it more likely to be cancerous. Infection agents are responsible for around 2.2 million cancer deaths annually. This does not mean that these cancers can be caught like an infection. Rather, the virus can cause changes in cells that make them more likely to become cancerous. Around 70% of several cancers are caused by human papillomavirus infections, while liver cancers and non-Hodgkin hypomania can be caused by the hepatitis B and C virus, and lymphomas are linked to the Epstein-Barr virus. Bacterial infections have not been thought of as cancer-causing agents in the past, but more recent studies have shown that people who have Helicobacter infections of their stomach develop inflammations of the stomach lining, which increase the risk of stomach cancer. Genetics. Some people are unfortunately born with a genetically inherited high risk for a specific cancer. This does not mean developing cancer is guaranteed, but a genetic predisposition makes the disease more likely. Apart from the above mentioned, there are various other causes responsible for cancer. Signs and symptoms of cancer. Unusual lumps or swelling. Cancerous lumps are often painless and may increase in size as the cancer progresses. Coughing, breathlessness, and difficulty swallowing. Be aware of persistent coughing episodes, breathlessness, or difficulty swallowing. Changes involve habits such as constipation and diarrhea and other blood found in the stools. Unexpected bleeding includes bleeding from the vagina and passes or blood found in stools, in urine, or when coughing. Unexplained weight loss. A large amount of unexplained and unintentional weight loss or over a short period of time, which shows itself in extreme tiredness and or severe lack of energy. If fatigue is due to cancer, individuals normally also have other symptoms. Pain in age includes unexplained or ongoing pain or pain that comes and goes, appetite loss, feeling less hungry than usual for a prolonged period of time, a sore on ulcer that won't heal, including a spot sore, wound or mouth ulcer, heartburn or indigestion, persistent, persistent or painful heartburn or indigestion. These are few symptoms of cancer. Cancer staging. The classification of cancer by anatomical extent of the disease, that is, stage, is essential to patients' care. Research in cancer control, the UICCT-M staging system, is the common language adopted by oncology health professionals to communicate on the cancer extent for individual patients. Once the stage cancer is known and understood, this is often a basis for deciding appropriate treatment in individuals' prognosis. The T&M classification focuses on the anatomical extent of the tumor and is determined by assessing the following categories. T describes the size of the main tumor. N describes whether the cancer has spread to the nearby lymph nodes. M describes whether the cancer has metastasized, spread from the primary tumor, preventing cancer. Cancer risks can be reduced by not using tobacco, maintaining a healthy body weight, eating a healthy diet including fruit and vegetables, doing physical activity on a regular basis, avoiding or re- reducing consumption of alcohol, getting vaccinated against HPV and hepatitis B if you belong to a group for which vaccination is recommended, avoiding ultraviolet radiation and using sun protection measures, ensuring safe and appropriate use of radiation in healthcare, minimizing occupational exposure to ionizing radiation, and reducing exposure to outdoor air pollution and indoor air pollution, including radon. Next, Prabhakar.
So I'd like to begin. So there are various ways in treating cancer and managing it as well. So first off, we have surgery. So if a cancer has not metastasized, which is to spread, surgery can remove the entire cancer, which may completely cure the disease. Often, this is effective in removing the prostate or a breast or testicle. Next, we have radiotherapy. So radiation treatment or radiotherapy uses high energy rays to reduce a tumor or destroy cancer cells as a stand-alone treatment and in some cases in combination with other cancer treatments. So next up we have chemotherapy. So chemotherapy uses chemicals to interfere with the way cells divide, so damaging of DNA so that cancer cells will destroy themselves. This treatment is tar- these treatments target any rapidly dividing cells, which is not necessarily just cancer cells, but normal cells usually can recover from any chemical-induced damage while cancer cells cannot. Chemotherapy is generally used to treat cancer that has spread or metastasized because the medicines travel throughout the entire body. It is a necessary treatment for some forms of leukemia and lymphoma. Next up, we have immunotherapy. So, immunotherapy uses the body's own immune system to fight the cancer tumor. Immunotherapy may treat the whole body by giving an agent that can shrink tumors. Next is hormone therapy. Several cancers have been linked to some types of hormones, including breast and prostate cancer. Hormone therapy works to change hormone production in the body so that cancer cells stop growing or are killed completely. So next we have gene therapy. The goal of gene therapy is to replace damaged genes with one that work to address a root cause of cancer, damage to DNA. Other gene-based therapies focus on further damaging cells damaging cancer cells, which is DNA, to point where the cells destroyed themselves. However, gene therapy is new and has not yet resulted in any successful treatments. So, next topic is the awareness, understanding myths and misinformation about cancer. So, accurate information and increased awareness and knowledge about cancer can empower all of us to recognize early warning signs, make informed choices about our health, and counter our own fears and misconceptions about cancer. So, know your body, early detection saves lives. Many cancers show early signs and symptoms, indicating that something isn't quite right. These include breast, cervical, colorectal, skin, oral, and some childhood cancers. This is important to know because finding cancer early almost always makes it easier to treat or even cure, which means improved chances of survival and quality of life for people diagnosed with cancer. Each of us can be empowered with the right information to know what's normal for our bodies and recognize unusual changes. And importantly, seek professional medical help promptly. Next up, we have myths, misinformation, and stigma. Cancer understandably causes fear. However, misinformation, misconceptions, and stigma surrounding cancer include that there is no cure, create a negative cycle that can confirm our fears. These fears and misconceptions can prevent us from screening or consulting for early symptoms, or to delay or avoid treatment and care altogether. A late diagnosis and developed treatment generally result in worse outcomes, which in turn perpetuates the myths and misconceptions of cancer being incurable or untreatable. So, in that case, what can we do? Access accurate cancer information. By being informed, you can counter your misconceptions and reduce your fears about cancer. Through knowledge, awareness, and understanding, you are empowered to challenge negative beliefs and attitudes in order that perpetuate myths about cancer. So use your voice. By talking, we can help to reduce fear, stigma, and discrimination, shift perceptions, and strengthen support for people with cancer. Understand different cultural beliefs. So, understanding different cultural beliefs and practices regarding health and cancer is essential in developing appropriate responses. Changing attitudes and dispelling common myths. Empower individuals and communities. Governments, communities, employers, and media all have a role to play to challenge perceptions about cancer and create a culture where people living with cancer do not face discrimination. So, let's come up with the fast fact. So, cancers that is diagnosed at an early stage is more likely to be treated successfully. Almost all women diagnosed with breast cancer at the earliest stage, for instance, survive their disease for at least 5 years. Now, give me a next slide, please. Yeah. So, we have the key cancer facts. So, there are 10 million people die from cancer every year. At least one third of common cancers are preventable. Cancer is the second leading cause of death worldwide. Around one third of deaths from cancer are due to tobacco use, high body mass index, alcohol consumption, low fruit and vegetable intake, and lack of physical activity. Almost 70% of cancer deaths occur in low to middle income countries. Millions of lives could be saved each year by implementing resource appropriate strategies for prevention early detection and treatment. The total annual economic cost of cancer is estimated at US dollar, that is 1.6 trillion. World Cancer Day is an inclusive platform for voices from all corners of the world, including the remotest areas. So this has been given by Dr. Roger Dempsey, SVP Global Oncology Clinical Research MSD. So with this, we've come to the end of the presentation. And for now, I would like to request our District Nodal Officer and Program Officer, Sir Samit Century, to share his thoughts on today's event. Thank you.
Good afternoon to all the NSS volunteers present here. In order to observe this World Cancer Day on 4th of February, that is today, and as I was speaking to you all, that this day is observed by almost all the major institutions around the world in order to remind us that the as an individual the role that we can play and to bring the awareness at the global level about the impact of cancer. From the presentations and the slides, you all have already got the information about why do you need to know about cancer. Okay, and cancer is the second leading cause of global death. If it is uncontrolled growth, you know, of a group of cells in the body, and this is something that is unwanted, and there are different types of cancers as we have come to know, and this can occur at any age, and if not detected at right time and if not treated, uh, there are chances that it becomes risk to your life as it is very much fatal. So therefore the International Cancer Control Union has played a major role in uh, propagating this message and initiating the observance of this day. As we know that we are celebrating the theme that close the care gap, and this theme rightly points out that in fact in this pandemic itself, uh, though we might have been deviated from cancer, but we cannot forget that uh, cancer is a very fatal disease. So the main aim of the initiative is to motive reform and inspire action even after World Cancer Day. This awareness, the programs that we do on a regular basis as an NSS unit, the message that we are trying to give out to the masses is that in no matter whatever disease it is, it should not be taken lightly. In fact, we are trying to spread this message among the people that uh, we should take initiative to know, to take the information correctly, to consult the experts, and to take all the preventive measures and steps to control this kind of diseases. When we choose to come together, we can achieve what we all wish for, healthier and brighter uh, health. And NSS volunteers have always taken initiative to spread this uh, awareness related messages among the people. And concluding my message, I would like to congratulate all the NSS volunteers for organizing this awareness webinar um, among to spread this you know the significance of this day by observing it. Let us spread this message to everyone, um, that cancer is not to be taken lightly. If there are the symptoms, uh, individuals should consult the experts and take good initiative to get rid of these diseases. Okay, so with this, thank you everyone. Thank you so much.
Thank you, sir. Lastly, as we have come to the end of today's webinar, I would like to thank our district nodal officer and program officer, Sir Samit Century, for giving us this opportunity to spread awareness about such an important cause. And I would like to thank all the other NSS volunteers who participated in today's event. Thank you once again and have a good day.
Okay, I hope Rigzan has taken the attendance. Okay, please take the photographs as well as we require it. So I would request everyone to please be there and not to leave the group, as I'll be taking the group photograph as well from my side. Okay, so please be there.